this humble building in a corner of Lake County, there's a physician who's been dubbed a GERD warrior.
GERD, G-E-R-D, stands for gastroesophageal reflux disease. And as we get out here to win this battle against heartburn,
Remote 1, copy.
this is a war.
Proceed to the patient's right nostril.
And we need warriors. And Dr. Perez is a GERD warrior.
Dr. Mario Perez is a primary care physician. He's joined Dr. James Rosser to fight esophageal cancer.
Remote 1, getting ready to withdraw.
Perez is in his office in Lake County. Rosser is in Osceola County. They're doing their work through a robot with a two-way camera that allows Rosser to guide every move.
I said, what if we could train primary care physicians? There's more of them that could actually screen these patients and do this under my remote guidance. So it would be just like I was there.
Now let me see if you can back that thing up. Oh yeah, back that thing up. All right.
The procedure that Perez is learning is currently only done by surgeons.
Excellent.
You really witnessed a bit of history.
Perez is the first general practitioner to learn the procedure with the help of telemedicine. The doctor uses the scope to check for signs that a patient's severe heartburn could develop into esophageal cancer.
The doctor says half of the people who need to be checked out never do it because they're scared of anesthesia or they can't afford it. Having the screening done in your primary care doctor's office can save thousands, and it just requires a local anesthetic.
We're looking for lesions, especially on the proximal esophagus.
The procedure requires the doctor to thread a scope up the patient's nose and down their throat into the esophagus and stomach.
It takes about 7 to 10 minutes at the most, and because the patient has no general anesthesia, it's an office-based procedure.
The first few times that Perez performs the procedure on a patient, Rosser will be guiding him from his office a county away.
All I need him is listening to the big guy in the sky and following my commands so we can have the same quality by Dr. Perez that you would have if I did it.
Bravo, Hollywood outside view. All right.
Thank you, boss.
The hope is to one day train lots of physicians to do the procedure.
Pretty much any provider in the United States and in the world can be doing these procedures in their office or anywhere.
But this office will always be home to the first of Rosser's warriors. In Claremont, Dana J., Fox 35 News.